All right, we're back now with a GMA health alert about memory loss. Recognizing early warning signs can be key when you're diagnosing and treating dementia. But how do you know the difference between typical age-related memory loss and something that's more serious? So, of course, we're bringing in ABC News medical correspondent, Dr. Darien Sutton here. Good afternoon. So how do we know?
Yeah, well, I think it's important to understand that forgetfulness can be a normal part of aging. We all talk to our parents, for example. We notice when they might not be able to remember a word or a name. That can be a normal, consistent part of aging, but when it starts to interrupt your daily life, that's when we get concerned about the diagnosis of dementia. And we have to remember that dementia is a progressive diagnosis, which means that it gets worse over time. And unfortunately, there is no cure, but there are treatments that can delay those symptoms.
So if it gets worse over time, what are some of the early warning signs to look out for? Because you hear about things like mom brain or brain fog. Yeah. Are those early symptoms or no?
I don't qualify those as early symptoms. And just to clarify, if you are forgetful in general, some of my friends are, for example, that doesn't necessarily mean you're going to develop dementia. There are many reasons why we might forget. For example, not looking at you, DeMarco, we might not be paying attention specifically, for example. I have to always get it, DeMarco. And we might not be able to recall the specific details, but that can be a normal part of just...
I think that happens a lot with me and Janae.
Oh,
sometimes
does it?
I look at her and I'm like, and she's talking to me and I'm like, I'm thinking about something else.
Understandable, and it's completely, and it makes it more difficult for you to recall that event, even though it's important to you. But when we talk about dementia, there are some red flags that you have to pay attention to. For example, if you're having a difficult time with simple tasks, making coffee, making tea, getting lost in familiar settings, or forgetting the names of people that are important to you, that's when I get concerned about red flags. And just as a note, when we talk about dementia, many people ask, well, what's happening in the brain when dementia is occurring? And there's a couple of different ways that it can happen because it's not the same for every person. In one instance, you can have a decrease in the blood vessels that can deprive the brain of oxygen. For example, a life of untreated high blood pressure or a life of untreated diabetes. In other instances, you can have a buildup of protein. That can be a cause of things like Alzheimer's disease, and that can cause the brain to shrink, and you lose those distant memories. And unfortunately, that can lead to those symptoms affecting your learning, your memory, and your decision making.
You know, I'm going to ask you, like, what more can we do then? Like, what do we need to know about brain health?
Yeah, well, 7 million people live with this diagnosis of dementia, and it's expected to increase by the year 2050 to 13 million. But 42% of dementia cases are potentially preventable. And there are things that we all can do in our daily life that can help to save our brain and keep our brain healthy. Number one, we talk about this all the time, remaining physically active. The minimum 150 minutes a day, that's 20 to 30 minutes a day. DeMarco, you and I talk about that all the time, trying to get to that minimum. And then also remembering that you can, making sure that you're socially active, and also, most importantly, getting your vision and getting your hearing checked. And this is something that is what I call low-hanging fruit. When you have vision loss, when you have hearing loss, that causes you to withdraw, increases your risk of depression. I think it's really important to remember that you can also get hearing aids, for example, over the counter. These are some examples that we've got. Geomodeling. This is really, really, really important. Getting tested with your hearing is also helpful, of course, to make sure that you understand the root cause.
And you can control the volume as well.
Yeah, you sure can.
Yeah. On and off.
On and off, right? All right, Doc, thank you. We appreciate it.